everyone, welcome to Your Health Today. I am Dr. Olaide Jinodu. We'll be talking about tuberculosis today. What is tuberculosis? Tuberculosis, also known as Koch's disease, is a very infectious multisystemic disease. Now when I say multisystemic, meaning it affects a lot of systems in the body. There are two main categories. We have the pulmonary tuberculosis and the extrapulmonary tuberculosis. Now what does this mean? The pulmonary tuberculosis is that affects the respiratory system, the lungs, okay, and this accounts for 85% of the tuberculosis infection. Now the other part, the other category, the extrapulmonary, we have the TB meningitis, when we have meningitis of tuberculosis causes, okay, that's the origin. We have TB, tuberculosis of the abdomen, the digestive system, okay. We also have TB of the spinal cord, Pott's disease, So fine, that has been classified. Let's talk about the epidemiology. Tuberculosis is very, very common. It shouldn't be played with. It's very common. In fact, the WHO classifies it as the most common cause of infectious related deaths, mortality, And in 2009 alone, over 1.7 million people died of the disease. In fact, as we speak, it's been estimated by the WHO, that's the World Health Organization, that over 2 billion people are currently living with latent tuberculosis. That being said, what are the signs and symptoms, the common signs and symptoms of tuberculosis? Number 1 is chronic cough. Number 2, drenching night sweats. Number 3, chronic weight loss. Now when we say the word chronic means long-standing. It talks about the chronology, timing, not severity. So a lot of people think that chronic means something very serious. Not necessarily. It talks about longevity, something that has lasted for a very long time. So if you've been coughing for over a month, productive of sputum, you're bringing out sputum, you want to think, let me get myself screened of tuberculosis. Drenching night sweats, when you lay down at night and you're sleeping, you wake up to find your old bed sheets wet, soaked in sweat. This is because the Mycobacterium tuberculosis, which is the causative agent of tuberculosis, is usually deactivated in the day, radiation we get from the sun. So at night, it has a field day to continue its evil enterprise, if you know what I mean. Then also chronic weight loss. Now let me state this, that it has been discovered that most people that have tuberculosis have HIV looming somewhere. I'm not now saying that everybody that has tuberculosis has HIV, but I'm saying that you should get screened for HIV the moment you've been diagnosed positive for tuberculosis. Tuberculosis is very treatable. It is not a death sentence. I remember this account of when I was seeing a patient, a quite well-to-do patient, and he was really offended when I made a diagnosis of tuberculosis. In fact, he wanted to walk out of my office. That, doctor, what do you mean by that? How can I get tuberculosis? Because it's usually associated with the poor. But let me ask, this man has a driver, right? He has a cook, so he can get the tuberculosis. It's not a death sentence. It's very treatable. I'd like to sound this note of warning that whenever, if by mistake you've been, or if by chance you've been diagnosed to have tuberculosis, please follow through with the drugs. I know it takes a long time to get it treated. It can take 6 to 8 months or even 12 months to get it treated adequately, but please follow through. Do not stop your drugs because you feel better. If you do, you're going to encourage drug resistance. This is one challenge we're facing right now. We have this disease growing in numbers, especially in sub-Saharan Africa, and yet a lot of people are not using their drugs. Please, if you know anybody that has tuberculosis, or if you have tuberculosis, please be encouraged to use your drugs till your doctor deems it fit that you stop. Now, if you've just listened to this and you love this, I would like you to like, share, post your comments, tag your friends, and don't forget to subscribe to our YouTube channel. Thank you very much.